Good morning, ladies and gentlemen. Welcome to the Global Healthcare Unity Summit. We're doing this on COVID Unity, created by Voice of Healthcare and the Times of India. Voice of Healthcare acts as a nodal body and visionary think tank for policy advocacy, idea mobilization, and sustainable advancement in healthcare. Times of India, as you well know, is India's largest circulated English newspaper, and we pride ourselves in leading conversations that initiate social and policy changes in arenas that matter the most. Uh, I would also like to take a moment to mention our country partners here, Great Britain and Northern Ireland, Israel and Taiwan. Our associate partners, Dr. Wilma Schwabe, India, our educational partner, Chitkara University, and well-wishers, Wadia Hospitals. Knowledge partners, Praxis Global Alliance. The summit aims at decoding chaos and arriving at common roots of moving forward for healthcare by breaking down silos, sharing wisdom, and tapping into the lateral potential. COVID unity is an aspirational concept connoting an inclusive and cohesive umbrella of collaboration between the various spokes and stakeholders. It aims to take on the challenges of COVID 19 via a united force. During this 2 day conference, some of the best minds from the fields of medicine, diagnostics, medical equipments, heads of some of the top healthcare facilities from India, and policymakers will discuss and deliberate on India's preparedness, future strategies, and the roadmap to cope with the pandemic at a global level as well. I would like to now invite Sudha Natarajan, Director Response BCCL, to deliver the welcome note for the summit.
Good morning, ladies and gentlemen. On behalf of the Times of India, it gives me immense pleasure to welcome you all to the Global Healthcare Unity Summit, COVID Unity. Along with our partners, Voice of Healthcare, which acts as a nodal body and visionary think tank for policy advocacy, idea mobilization, and sustainable advancement in healthcare, we are making an attempt to deliberate on the current crisis and dwell upon the competencies and energies to overcome the challenge, prepare for the future, and lay the seeds of a bold new era of collaborative progress. Solidarity, hope, and coordinated global response is needed to tackle COVID-19 pandemic, says our UN Secretary General Antonio Guterres. And this is what we are going to showcase in these 2 days. As the global pandemic total reached more than 31.8 million cases, the summit emphasizes on the global effort to speed the development of new drugs, vaccines, and tests to battle COVID 19 and the financial support needed to overcome it. COVID Unity represents the spirit and ethos of strength in numbers and reminds us that no matter how big the challenge, as a synergized team, we shall always stand a chance to overcome it. I would like to take this opportunity to extend a warm welcome to our chief guest, Professor Dr. Balram Bhargava, Secretary, Department of Health Research and Director, Indian Council of Medical Research. We are honored to have amongst us leading policymakers and health experts from partner countries who will be showcasing and sharing their experiences from UK, Israel, and Taiwan. Please join me in welcoming Mr. Chung Yang-shik, Deputy Minister of Health and Welfare, Taiwan, Mr. Alan Gemel, Her Majesty's Trade Commissioner for South Asia, and other distinguished representatives from Ministry of Ayush and Ministry of Chemical and Fertilizer, who shall be sharing their views over the next 2 days. Being the largest media house in the country, we strongly believe that we have an important role to play in filling information gaps and counter misinformation and disinformation about the spread of the virus. With this thought in mind, we launched the immensely popular Mask India movement, aimed to encourage everyone to wear masks to stall the spread of the coronavirus. This movement was also commended by our Honorable Prime Minister, Mr. Narendra Modi. During this 2 day conference, we will see some of the best minds from the fields of medicine, diagnostics, medical equipment, heads of some of the top healthcare facilities, and the policymakers discuss and deliberate on India's state of preparedness future strategies, and the roadmap to cope with the pandemic. I would like to take this opportunity to thank our partner, Voice of Healthcare, esteemed speakers, and all attendees, and wish the event a great success. Thank you.
Thank you, Sudha. And I would now request Dr. Naveen Nishchal to address the audience and tell us more about COVID Unity. Dr. Naveen Nishchal, Chairman, Voice of Healthcare.
Thank you very much, Priyanka. Thank you very much. So although we are still waiting for our chief guest, but I will, start with other guest of honors. So, respected chief guest, Dr. Balram Bhargava, Secretary, Department of Health Research, Ministry of Health and Family Welfare, and Director General, Indian Council of Medical Research. Our guest of honor, Chung Liang Chi, Deputy Minister, Ministry of Health and Welfare, Taiwan. Our guest of honor, Alan Jemel, Her Majesty's Trade Commissioner for South Asia, and British Deputy High Commissioner for Western India, and other dignitaries on the dais. Dear visitors from all over the world, on behalf of Voice of Healthcare, I welcome you all for this grand event. But before I start my address, I would like to thank all the frontline warriors, unsung heroes, those who are risking their lives along with their families. My sincere gratitude and a big salute to them. As you know, we are going through the biggest health crisis of our lifetime, where every individual, every organization, every country is struggling to stay afloat. There are so many uncertainties, so much of terror amongst people about the common enemy, which is SARS-CoV-2 or COVID-19. Health has never been given such an importance in the past. Trade and politics have always dominated globally. This is the first time when healthcare has become the dominant reason of unity and collaboration. When I came up with the idea of COVID Unity, it made more sense to me that when all countries across the globe are collaborating to contain the common enemy of the mankind in a united way, so this theme is quite relevant in the current circumstances. And because of COVID Unity, we are not only helping each other with the resources, but with the exchange of ideas, knowledge, and much more. Voice of Healthcare is a not-for-profit entity, and we are working with several national and international organizations, helping them in uniting and collaborating. While we are doing a lot of activities to connect and co-create innovation, products, knowledge exchange, academy at various levels, but we feel that there is still a huge gap in terms of connecting and healthcare unity. I keep meeting a lot of people, and even today I see that individuals, organizations, and countries, they're working in silos. The idea of this summit is to kickstart another chapter of concerted and coordinated way of collaboration in healthcare and unite all healthcare players onto a common platform. This summit is just a beginning of more and more collaboration and healthcare unity across the globe. Voice of Healthcare can't have a better partner than Times of India in its initiative to unite healthcare industry across the globe. There is a saying, where there is unity, there is always victory. I'm thankful to our global partner, Great Britain, Taiwan, and Israel for their contribution towards this event. During these 2 days, we have many power-packed sessions of eminent speakers from all over the world, and these speakers are with tremendous experience. Here we will be discussing all the pertinent issues. Again, the idea is to further foster collaboration, unity, and come up with set of solutions to fight COVID as a part of COVID Unity's community. To conclude, I'm thankful to all the visitors, partners, speakers, delegates, guest of honors. I can see Alan Jamel here, and our chief guest, Dr. Balram Bhargava, who's just about to join the session, for being part of this occasion. Thank you very much. Thanks a lot. Thank you.
Thank you, Dr. Nischal. And now we would like to hear from Audrey Tang, Minister from Taiwan, and what he feels about COVID unity and this summit.
Hello everyone, I'm Audrey Tang, Taiwan's Digital Minister. It's my great pleasure to give the opening address of the Global Healthcare Unity Summit. India and Taiwan are close partners in economic interflow and also medical and health collaborations. It is then my great honor to be invited, and what I'm going to share is about the technology that we used to counter the coronavirus. The National Cheng Kung University in particular and many counterparts in India have held many webinars around these issues, but I'm told that this is the largest one so far. And so I'll repeat some of the things that you may have heard and hopefully also add some of our perspectives. With geographic proximity and close cultural economic interaction with the PRC, at the beginning of the outbreaks, everybody thinks that Taiwan would be the one hardest hit. However, up to date, with like more than 29 million confirmed cases worldwide, nearly 940,000 deaths, Taiwan has fewer than 500 confirmed cases and only 7 deaths so far. Science and technology plays an extremely important role in the counter-COVID strategy. We implemented preventative measures from day one, literally day one of this year, including border controls, community management, and so on. And many smart systems are then set to protect people's health and privacy. Fast, fair, and fun are the 3 core pillars of the combat through social innovation. And so I'd like to introduce 3 important strategies. That's the digital fence, the mass rationing plan, and the transparency open government. First, the digital fence is what we use to track people under quarantine for 14 days. If they turn off their mobile phone or unlawfully leave the quarantine area, the system will send an automated SMS alert message to not only the quarantined individual, but also civil affairs departments, health departments, and the local police to ensure that they fit the full compliance. The telecom service providers voluntarily work with the system, but they collect nothing more than the locations through the signal strengths of the quarantined one's mobile phone, which they're already collecting anyway. Second, the mass rationing plan is the integrated achievement of the applications developed by the civic technologists and the National Health Insurance Administration. It provides a fair chance, online and offline, for everyone to get medical masks from the pharmacies and also convenience stores. And so we have a strict regulation on the Taiwan's National Health Insurance System, so the IC card that everybody has for the National Health Insurance can only be used for public services. It's never for the commercial uses, nor for the use outside of the reading of the records. And last but not least, the people can get epidemic intelligence through routine access through the live press conferences always live streamed from the Central Epidemic Command Center or the hotline 1922 and many chatbots as well. And the CECC also make the intelligence and policy announcements easier for the public to understand by using a spokesdog, the 总裁, the Shiba Inu. It's like a dog meme, so that we can increase people's trust in the scientific messages and complying with epidemic prevention measures. And so during this pandemic, all of us become a beneficiary of the open government national strategy. The transparency pillar increases the mutual trust between the civil society and the government. The participation pillar refers to the innovation from the people and the full support from the government. The mutual trust and collaboration is at the core of the Taiwan model. In addition to donating medical masks to many foreign friends with humanitarian aid programs, what's more valuable is that we can provide the new epidemic prevention model mobilized by the whole society and the power of digital social innovation. Here, I wish everyone good health and stay safe, live long and prosper.
Thank you. We just heard from Audrey Tang, and now I would request our guest of honor, Alan Gemmell, Her Majesty's Trade Commissioner for South Asia and the British Deputy High Commissioner for Western India, to tell us a little about what he thinks about the summit.
Thank you, Priyanka. Thank you, Dr. Naveen, for this wonderful initiative. Chief guest, representatives of the Government of India, Minister Tang from Thailand. It's a very good morning to you all from me here in Mumbai, and a great pleasure, as I say, to be part of this initiative. I'd also like to thank Times of India and Voice of Healthcare for creating and crafting such a critically important platform for us to discuss the importance of collaboration at this time. I'd also like to thank the many UK colleagues who will be participating over the course of this exciting summit. In the words of Honourable Prime Minister Modi, the UK and India are an unbeatable combination, and we saw the power and importance of that combination and collaboration during our initial response to the COVID outbreak and today. We remain grateful, incredibly grateful to the Government of India for the support that we received during our initial response to the COVID outbreak, and that was support that saw the export of almost 3 million paracetamol tablets and almost 11 million type IIR masks to the UK as part of our initial response. But it was also a response that, in partnership with state governments across the country, helped us repatriate 17,000 British nationals and help many Indians who are performing critical services for the UK's businesses as essential workers here in India get to their offices. So I pass on the grateful thanks of the UK government to the Government of India and state governments across India for the support that we saw during that initial phase of the outbreak. I'd also like to thank, as we've heard, the healthcare workers in both our countries for the continuing roles they play saving lives and reducing the impact of COVID. We, of course, in the UK are incredibly grateful to the 60,000 doctors of Indian origin who are critical healthcare workers in our National Health Service. But to return to the power of that unbeatable combination that Prime Minister Modi mentioned, we would say that the world is looking to this UK-India collaboration to play a leading role in the global response to COVID. And that leading role includes the AstraZeneca UK Serum Institute of India collaboration. And we know that the Serum Institute has partnered with the UK's AstraZeneca to produce Oxford University's COVID-19 vaccine, which is termed the world's most advanced coronavirus vaccine candidate. We also see Oxford Nanopore Technologies Limited, a leading UK company with real-time nanopore-based DNA RNA sequencing capability, work with some of India's renowned scientific institutions for the rapid sequencing and analysis of patient samples with novel coronavirus, thereby supporting both researchers and public health experts in understanding the virus and its behaviour. Behold AI is a UK health technology company using its AI algorithm for triaging COVID-19 patients through a chest X-ray, providing an automated response in 30 seconds. And this will be used across the Apollo Hospitals group. We've also seen the Global Gene Corporation, GGC UK. GGC has expanded its genomics technology platforms, originally developed to enable large-scale studies on human health to create next-generation therapeutics, to include a multilingual contact tracing platform with mobility passports and individual risk evaluation for effective response to COVID-19. And these are just some examples of the unbeatable combination and partnership and collaboration that we see between the UK and India. Obviously, this is a difficult time for our broader economies and our healthcare systems, but we are also seeing incredible innovation and disruption in those systems as both our countries respond to the particular challenges of COVID. Our Prime Ministers, the UK and the Indian Prime Ministers, want to build an ambitious partnership between our countries through to 2030. Overall trade between both countries approached £24 billion in 2019. That was up almost 10% in just 1 year. And we have significant collaborations, as you've heard already in my speech, across the healthcare sector, but in many other sectors. In healthcare, we've seen technology and medical technology giants like AstraZeneca, GlaxoSmithKline, and Smith & Nephew alone support over 10,000 jobs in India through their offices and manufacturing units. Trade is at the centre of our UK-India partnership. We held a virtual joint economic trade committee in July, where my boss, the Secretary of State for International Trade, Liz Truss, met with her opposite number, Shri Piyush Goyal, agreeing to an enhanced trade partnership between our countries and a roadmap to a potential free trade agreement. As a continued commitment to working together, we're also hosting the first UK-India Meet on Life Sciences next week, which will see participation between key industry leaders and academics from both sides, very much in the spirit of COVID unity and collaboration. And those participants will discuss innovative technologies and potential therapeutics for existing and emerging healthcare challenges. And I'm delighted that colleagues at the Department for International Trade are here today to work with industry experts and others in the COVID Unity Summit to further enhance this successful UK-India collaboration. Thank you very much for allowing me to join today.
Thank you so much, Alan. And I would like to now move on to a recorded message that we have from our guest of honor, Chung Liang Shi, MD, PhD, Deputy Minister of Health and Welfare from Taiwan.
Ladies and gentlemen, I'm Chung Liang Shi, Vice Minister of the Ministry of the Health and Welfare. It's my great pleasure to give the opening address of the Global Healthcare Unity Summit. Taiwan government has been promoting new southbound policy since 2016, which calls for developing comprehensive, mutually beneficial relations with countries in the Association of Southeast Asia Nations and South Asia, Australia, and New Zealand. India is always listed a key country in all areas. This year, COVID-19 wreaked havoc worldwide. What we suffer are not just life's rules, but also in all dimensions. Taiwan is one of the few countries which have been able to contain the spread of the COVID-19 quite effectively. Taiwan, only 130 kilometers from mainland China, not only has numerous visitors from China, but also have many people working and studying in China. Even Johns Hopkins University initially predicted that Taiwan would be the one of the hardest hit countries in the world. However, Taiwan's aggressive measures have paid off and successfully kept the COVID-19 at bay. Here I'm sharing today is about how Taiwan fights COVID-19. As of now, the global confirmed cases are smashing through 30 million. In Taiwan, we have 509 confirmed cases and 7 deaths. This success is not coincidence. The Taiwanese government integrated data from the national healthcare system, immigration, and customs authorities to aid in the identification and the response to the virus. Government's efforts are all coordinated through the National Health Command Center of the Taiwan CDC, established to aid in disaster management for epidemics following the 2003 SARS outbreak. The 2003 SARS outbreak led to the loss of thousands of lives, which makes our government and the people on high alert at the early stage. Last December, when we heard of the contagious new respiratory illness began to appear in China, we started preventive measures. We established the Central Epidemic Command Center, implemented border controls, and introduced the mandatory quarantine. After January 21st, when we had the first infected case in Taiwan, we started the strict investigation to track the travel and the contact history of every patient, which helps contain the community spread. Taiwan not only enacted border control procedure, but also enacted relief measures to counter the economic impact. After the setup, Taiwan government also hosted press conference to report the situation to the public and use social media, YouTube, Line, new channels to emphasize the importance of sanitary and prevention methods of COVID-19, to educate the public honestly and transparently. with public once a day. The government had implemented a ban on exporting face masks in order to ensure an adequate supply for citizens after the first case of COVID-19 was discovered in Taiwan within 3 days. Sale of masks was also strictly controlled in order to make sure every individual had access to them without people being able to buy and hold masks for private use. Also, we began a massive increase of production of medical masks as well as sanitizing alcohol. In addition, we started rationing face masks and quickly established a national team for medical mask production. In addition to the public health professionals led by Health Minister, all our citizens have done their part, such as the wear face mask, monitor body temperature, keep social distance, and maintain hand hygiene. This is a partnership we call Team Taiwan. COVID-19 is a global level disaster which requires a joint efforts of all countries. Despite the lack of the official diplomatic ties between Taiwan and India, both countries set up representative office in each other's respective capitals in 1995. Since then, we have engaged in dynamic, ongoing communication on many levels. For example, in this epidemic, Taiwan provided surgical masks to India in support of frontline medical personnel. Taiwan's researchers at Academia Sinica announced they have synthesized over 100 milligrams of the remdesivir. It took the team, which includes 2 members from India. Also, National Cheng-Kung University Hospital, Taiwan have been sharing experience related to COVID-19 information, including testing methods, treatments, approaches to containing infection, and measures concerning masks. Over 10,000 medical personnel in India benefited from these webinars. Taiwan has one of the world's top healthcare systems and strong research capabilities. Although Taiwan is unfairly excluded from the WHO and the UN, we are still willing to share and collaborate with the public and the international bodies. Over the past months, we established a national team. Now, we must take part in a global campaign and work together with other countries to set up a zone defense and comprehensively prevent the spread of this virus. No one can isolate a friend who genuinely wants to help. Out of the humanitarian concern, Taiwan cannot stand by while countries are in dire need of assistance to stop the spread of the virus. We are willing to provide assistance to the international community in 3 areas: face masks, pharmaceuticals, and the technologies. Taiwan will actively bolster our cooperation with other countries to prevent the spread of the COVID-19. In times of crisis, countries around the globe must unite, show solidarity, provide mutual assistance, and work together to fight the coronavirus. Taiwan is willing to exert its influence in this battle and join hands with the international communities so that we can overcome this challenge together. Taiwan can help, and Taiwan is helping. Here, I wish everyone good health and stay safe. Thank you so much.
It's indeed very heartening to hear of the help and the support that countries have provided to each other and to their own citizens. And in this regard, I would now ask our chief guest, Dr. Balram Bhargav, to also speak to us and tell us a little about the initiatives taken here. Dr. Balram Bhargav is Professor of Cardiology at the All India Institute of Medical Science, New Delhi. He also serves as the Executive Director for Stanford India Biodesign Center, School of International Biodesign. He has also taken over as Director General, Indian Council of Medical Research, cum Secretary, Department of Health Research, Ministry of Health and Family Welfare, Government of India. Welcome, Dr. Bhargav. We would love to hear from you.
Okay. Thank you so much. At the outset, I would like to congratulate the Times of India for this Global Healthcare Unity Summit, which is an excellent initiative taking along several countries, India, United Kingdom, Israel, and Taiwan, to start with. And I would like to really say briefly, and I'll be giving you 2 or 3 slides as well. India is a very large country with the second largest population in the world. So everyone, whether it be the scientific community, whether it be the medical community, whether the global community, were worried how India as a large population will handle this pandemic once it hits the large population. Having said that, the government of India has had a very calibrated response to this pandemic. We have been able to build up the capacity for the hospitals, oxygen, testing equipment, personal protection equipment, masks, and the Honorable Prime Minister has taken all the states along with such tremendous unison that the whole country has faced this pandemic in a very united and a calibrated manner. The manufacturing of and I'll just come to the slides. I think that would be better. Can we see the slides? Just a moment. So can you see my slides?
Yes, sir.
Yes. Okay. So I'll have 3 or 4 slides. So how India augmented the COVID testing capacity? If we look at the 30th of January, we had just the capacity and only 10 tests per day were being done. And as we gradually increased to 15th of March, we were doing up to 1,000 tests per day. And by 15th of May, we were doing about 100,000 tests per day. And now in September, we are doing about 1 million tests a day. And yesterday, 1.5 million tests were done in India. And this is just second only to the United States of America in terms of the number of tests that are done. Now, what has happened is that India encouraged its startups. All the science ministries took up this challenge, and then we started developing methods for testing which would be valuable for the large cities. And then at the district level, we were able to repurpose the TrueNat and the CBNat machines which were used for tuberculosis testing for testing for COVID-19. We were also able to repurpose our HIV/AIDS machines or Abbott machines for testing for COVID-19, and this was well established, gradually done, and now we have more than 3% or 4% of the testing done by these methodologies. At the field level, we were the first country in the world to start the rapid antigen test, and these rapid antigen tests have now been accepted the world over, and many countries in the world are resorting to these rapid antigen tests for containment zones and for areas where there are large populations and you have to suddenly screen. The startups and the Ministry of Science, Technology, and the various scientific institutions, our IITs, our CSIR, the Department of Biotechnology, they were able to manufacture new kits for testing. And over the last 6 months, we have validated nearly 900 kits for testing, and the price of the kits has, because of so many companies manufacturing, we have been able to reduce the price tremendously, and now an RT-PCR test can come up to rupees 138, while the viral transport medium and the RNA extraction is about 90 rupees each. So the total test in an RT-PCR test is anywhere between $3 or $4 at the moment. So that is one thing that has happened in India. We have validated these kits, and many of them are indigenous, and now we have even started exporting these kits to many parts of the world for testing. Before I come to the vaccine, we know that we have, in terms of the medicines available, the treatments available for the for COVID-19, there is a paucity of drugs. However, we have scaled up production of medicines in India and are exporting a large number of them to different parts of the world. And you know that the 60% of the generics available in the United States of America are of Indian origin, and India is responsible for a large number of generics all across the world. Now, if we were to give an example of remdesivir, which is the drug approved at the moment for COVID-19, we were rapidly able to produce a generic version, and 4 different companies produced it, and therefore there was no shortage in the country for the medication remdesivir for COVID-19. In terms of the randomized clinical trials, not many randomized trials have been done or have changed the paradigm of treatment across the world. We've had the one major trial from the United States, that was the ACT-1 trial, which clearly demonstrated that remdesivir reduces the hospitalization stay from 15 days to 11 days. And that was the United States' major contribution to the world in terms of a randomized clinical trial. Following which, we had another randomized clinical trial from the United Kingdom, which was the recovery trial, which clearly demonstrated that cortisone or steroids are useful in patients of COVID-19. That was the United Kingdom's major contribution in terms of randomized controlled trials for COVID-19 for the world. In terms of India, we had the PLACID trial, which is the world's largest randomized trials on plasma therapy on more than 464 patients randomized for plasma therapy, and we clearly demonstrated that it is not helping moderate to severe patients or the progression of moderate disease to severe disease. So this was India's contribution in terms of science and the randomized control trial. So basically, these 3 randomized trials are really the large randomized trials which we have available for the treatment for COVID-19 and the contribution of the different countries for the same. Having said that, coming to the vaccine paradigm, a large number of countries have contributed to vaccines. We have a total of 118 vaccine candidates as we speak, and 38 of them are in different stages of clinical development, and we have them on this table shown. The front runner is the United Kingdom, Oxford University, AstraZeneca, which has partnered with the Serum Institute of India to produce this vaccine, and we are undergoing a phase 2B and a 3 trial in India for the same. Then we have 2 other Indian candidates, which are the Bharat Biotech inactivated Covaxin vaccine, which is completed its phase 1 trial, and the results are excellent. The phase 2 trials recruitment is completed, and we should have the results by the end of October for the phase 2 trial of the Covaxin trial, and they are embarking on the phase 3 very soon in the month early October. Then we have another Indian vaccine candidate, which is the Cadila Healthcare DNA vaccine, which is Z-CoV-D, which is also completed the phase 1 trials. The results are looking very good. The phase 2 trial is ongoing. Having said that, this is a 3-dose vaccine, so therefore the results may be slightly delayed, maybe by end of October or early November. We will have the results of the phase 2 trial, and therefore we have at this moment 3 vaccine candidates, and the Oxford candidate, which is the Covishield, which is being tested by the Oxford University and across the world, and as we look forward to the phase 3 results and then be able to use this vaccine. Now, we in India have, I think this, I can remove the slides now. This one. Anyway, so in India we have basically stuck to the principle of 5 T's for this disease, and that is testing, tracing, tracking, treating, and technology. So we have had the Arogya Setu and the Itihas apps, which have been useful in tracking people, and also the hospitals in India have geared up immensely rapidly in these last few months to have no shortage of beds, no shortage of oxygen, no shortage of personal protective equipment, no shortage of masks. And India is willing to and has been working with these friendly nations. We've had a team from Israel visit us. We've had contribution and collaboration with the United Kingdom. We have to learn a lot from how Taiwan has done well. So I think India had an advantage of being a late starter in terms of the disease, that we were able to calibrate our response and learn from other countries, whether it be the United Kingdom, whether it be the United States, whether it be Sweden or Italy or Europe, and as well as the Korea and Taiwan, etc., so that we could calibrate our responses according to the lessons learned there. And I feel that at this moment we are well poised in terms of the facilities that the country has. We would be helping other nations, and we are already helping other nations with the testing kits, PPE kits, as well as masks, and as well as medications. And we hope till such time that we have an effective vaccine available, we would urge the population of all countries, including India, to consider using the social vaccine, which is the mask. And that is probably the best vaccine at the moment. And having said that, more importantly, even when we have the vaccine, the use of the mask will still remain very important till the world grapples with this epidemic. So I wish this Global Unity Summit all success, and thank you so much for inviting me to participate. Thank you so much.
Thank you so much, Dr. Bhargav. It's really heartening to hear about the 1.5 million tests that we are doing per day now. Really gives us a lot of hope. And of course, the vaccines we are all praying and waiting for the vaccines to come in soon. So thank you so much for sharing all of that information. I would now call upon Sanjay Jha, NFC Coordinator, Voice of Healthcare, to give a vote of thanks to all our speakers.
Thanks, Priyanka. On behalf of Voice of Healthcare, I would like to thank Dr. Balaram Bhargava, Sir, Director General ICMR, our chief guest, for taking time out from your busy schedule and talking about how India has been able to really exponentially grow their testing capability. Doing 15 lakh tests was just unthinkable some time ago. So thanks a lot for you and your team and all our ministries to help India take this fight of the COVID. Thanks for updating us on the trials on vaccine and talking about collaborations with other countries. And looking forward to the vaccine coming up soon so that we can get out of this nightmare. Thank you, sir. I would like to thank our guest of honor, Her Majesty's Trade Commissioner for South Asia and the British Deputy High Commissioner for Western India, Mr. Aaron Jamil. Thanks, Mr. Jamil, for talking about how India and UK are working together to take COVID head on. It's a perfect example of COVID unity. I would like to thank Chung Liang Shi, MD, PhD, Deputy Minister, Ministry of Health and Welfare, Taiwan. Thanks for talking about Taiwan's success towards fighting COVID, something we all are learning from, and how Taiwan and India are working together. I would like to thank Tang Feng, Minister in Taiwan. Thank you for talking about initiatives taken in Taiwan to fight against COVID. I'd like to thank Ms. Sudha Natarajan, Director Response, Bennett Coleman and Company Limited. Thank you for a wonderful welcome address and for the foray into this conference. Last but not the least, I would like to thank Dr. Naveen Nishar, Vice Chairman, Voice of Healthcare, and our entire Voice of Healthcare team to plan this action-filled conference. Thanks all of the participants, panelists, delegates for taking time out to join Global Healthcare Unity Summit COVID Unity. Thanks our sponsors for supporting these events. Thank you.
Thank you so much, Sanjay. And the inaugural session is over. I hope every one of the audience members will be attending the summit which will start shortly with various panels over the next 2 days. And you will have a great learning and sharing experience up here. Thank you.